Good evening. The goals that I set up for myself at the beginning of the semester was to go into the clinical space with an open mind, eager to learn, and to be forgiving for myself with understanding all the neurotransmitters, diagnosis, medication management. I would say I did meet those expectations because um, throughout my clinical experience, I was able to distinguish based on characteristics that the or symptoms that the patient was having and aligning it with the diagnosis. Also, based on the symptoms that they were having, being able to see what the best class of medication would be for them. Even if I didn't choose the right medication, I did start off by saying what class of medication would be best for the client or the patient. So I would say I did meet that goal. Um, Feelings, prejudices, and biases that I experienced during my clinical experience and how did I manage them? Um, I feel personally with mental illness, mental health, I for a very long time ago, I was able to remove the stigma behind it. So didn't really have any stigmas with that. Um, One thing personally that is very hard for me and has never been easy for me to hear or witness is childhood sexual abuse or anything with sexual trauma, molestation. That's has been very hard for me. Thank goodness this semester I really didn't have to deal with that, but my previous clinical rotation I did, and that was very hard for me because one of the clients, it was very vivid when she would talk about it and the effects that it was still having to the present day for her. So overcoming it, managing it, what has been easier for me since I was first exposed to it, but I'm still working on that. I'm still working on that because I look at the victim and how hard it is for them. So I don't know if I would be able to have that same disposition to the aggressor. So I know that that's something that I need to work on as far as not being biased or coming off as judgmental, because everyone who comes in, to our space deserves a non-biased, non-judgmental provider. How did I manage anxiety, self-doubt, and or uncertainty? I definitely use self-talk. I use self-talk and told myself, that it's gonna be okay. That they're people just like me, and they're here with the same exact emotions and feelings, just like me. And that if I didn't know something, it was okay for me to not know something, and it was okay for me to take an informed guess, and that it was not per se the end of the world. So I think that was the biggest way for me to manage anxiety and self doubt, was to prepare myself clinically, and also to be more accepting if I did make a mistake, learn from it, and grow from it to not repeat it. What understanding or insights did you develop during your clinical experience? I would say I have definitely started to be able to make connections that I wasn't necessarily able to make before, as far as especially with the geriatric population, always putting in the back of my head what is their medical history, because we're talking about a lot of their psychiatric mental health history, but in the back of my mind I always have in my mind their medical history, because a lot of them are on cardiac medications. So I always kept that in the back of my mind when prescribing, or what options would be best available for the geriatric population. I didn't really have any new evaluations for elderly persons with ADHD, but whenever a client did come in and wanted something for ADHD and they had any kind of cardiac history, it was always in my back of my mind, this person is definitely going to be a candidate for a non-stimulant. And if they feel like the quality of their life is just so impaired that they would need to be on a stimulant to get cardiac clearance. So I would say that's the biggest insight that I got from this semester, is it is very important to look at all of their medications, to check for interactions, not only their psychiatric medications. Has reflective practice impacted you as a person, student, and or provider? If so, how? I'd say yes, especially in my personal life. Seeing, young children, being diagnosed with ADHD, it was a lot more common than I anticipated. So even in my personal life, I'm more aware of things that I should be looking out for, per se, that I might not have paid attention to, um, if I had not, experienced it during this clinical rotation. As far as anything else, I would say that was really the biggest thing for me. Will I continue to use reflection in future practice? If so, why? I would say yes. I think that reflection is really important, especially in psychiatric and in mental health, because it's important to know how we feel about particular, disease processes, medications, because as we continue to gain more comfortability with prescribing and with medications, I'm pretty sure we'll come to have our own routine or medications that we prefer, medications that we don't, if we can stay away from. So I will definitely, in that scenario, be very reflective of how I prescribe. I'll also be reflective in how I treat my patients, how I would want to be treated myself, and if I were in that situation. So I will definitely use that to when I'm in practice as well, to not forget that I'm a person too, and they're a person too. And I realize that, sometimes people are just one, day away, or one, mistake away from having a bad day. And that's something that, is inevitable at the end of the day to all of us, because we're people. So, sometimes the patient might come in, they're not having a good day. And, have grace for them, have mercy for them, and to, just remain professional. Otherwise, I had a wonderful semester, and you have been an amazing professor. Thank you.